Now, the mental health crisis affecting young people in this country is at an all-time high, especially with the rise of the COVID-19 pandemic. So joining us today to discuss this issue and his youth mental health advisory is the United States Surgeon General, Dr. Vivek Murthy.
Hi, welcome to the show.
I am so honored to have you here.
This
Well,
is
I'm so glad
so
to be here.
major.
Well, I'm excited to be here with you guys.
Oh,
Thanks for having me.
Thank you for coming.
Of course.
Now, our country has obviously struggled with addressing the profound mental health challenges and illnesses that children, adolescents, and young adults are facing. Why has it been so hard for us to find solutions that actually work?
Well, it's a really good question because you're right. Our kids have been struggling for a long time. But one of the challenges is this terrible stigma around mental health that prevents people from talking about the issue, that prevents young people from even coming forward and saying that they need help. And, you know, I've seen that stigma up front and personal. You know, as a young kid who dealt with a lot of issues with loneliness, and I was painfully shy, I had a hard time making friends, I had to deal with a lot of bullying when I was in middle school. Like, I felt the impacts, on my mental health. I felt anxious at times, I was worried often, but I didn't have sort of the wherewithal to figure out how to get help. I felt ashamed, actually. I thought I did something wrong. So I never told my family about it. So that stigma holds us back.
Yeah.
And it's also really overwhelming. When people think about mental health, they think, gosh, there's so much to do. I don't even know where to start. That is the reason why we issued this Surgeon General's advisory, because we wanted to call the nation's attention to the problem, but in terms that people could understand and to lay out concrete steps that we could all take as individuals, as schools, as workplaces, as technology companies and government, to finally take action to address youth mental health.
Wow. So necessary.
Well, so necessary. I want to ask you, the pandemic and COVID, do you think that has heightened mental health issues? And if so, how?
Well, Garcella, I think it has, actually. We've seen more kids experience anxiety and depression and loneliness during this pandemic. And if you look at what's happened during the pandemic, it's not surprising, right? We've had 140,000 children who have lost a caregiver during this pandemic in the United States. Think about the trauma that visits upon your life.
Sure.
But we've also had a lot of kids who experience other losses, right? They've not been able to see family and friends.
Yeah.
Right.
They've missed out on youth sports and school. They're not sure sometimes about what the future is going to look like.
Right.
It takes a toll on our kids. But the big thing for us to remember also is that this was a big problem before the pandemic.
So
Agreed.
true.
And this, I'll tell you one number that sticks in my head and that worries me, is that in 2019, 1 out of every 3 high school students in America said they felt persistent feelings of sadness or hopelessness.
Wow.
1 out of 3. And that was a 40% increase over the prior decade. That is a stunning statistic, right? And that means that our children are hurting. And we've got to do something to help them because,
Absolutely.
I think this is a parent first and foremost. I've got a 4-year-old and a 5-year-old.
Yes.
I want my children, if they're struggling, to know it doesn't mean that they're broken or they don't need to be ashamed.
Right,
I want them to be able to get help. I want them to know that the help is there.
Right.
if
And
they need
feel no shame about it, too.
Exactly.
That's right.
And that's why you have the Youth Mental Health Advisory. Tell us about it, and what is it that you want people to do?
Yeah, so the Surgeon General's office, on rare occasion, will put out an advisory like this because it's reserved for issues that are so critical and so important that we need to urgently call the country to attention and ask people to take action. So here's what we're asking people to do. So for individuals, we want people to fundamentally change how they talk about mental health, how they think about mental health, so people don't feel ashamed
Right.
if they're struggling.
There's no stigma to it.
Yeah.
Exactly, so they know they can get help.
Yeah.
We also want people to know that, again, if you reach out to people in your life, that can have a profound impact on supporting them during their time of need. Now, so many times we look at people and we think, oh, they have a great life. They seem
Right.
happy. They're surrounded by
Right.
lots of people. They're not struggling. But I'll tell you,
Never
it's
know.
hard to tell. You never know. And sometimes it's the outreach you do to regularly check on your friends that can make a big difference. We're also asking other sectors to step up. We want schools to have more counselors and therapists. We want schools to also invest in social and emotional learning curriculum, which can help our
Yes.
kids. We want technology companies, especially social media companies, to take responsibility for the impact that they're having on our children.
Yes.
Let's please do
Yes.
that.
Surgeon General Murthy, what parts of society would you like to see get more involved? You just said the social media. How can we make that happen?
Well, certainly, look, there's some kids who benefit from their engagement on social media. They find community, they find connection.
Yes.
But there are other kids who struggle, right? They get bullied online. They get into this hyper sort of comparison culture where they start to feel worse and worse about themselves because they compare their average days to everyone else's best days, and they always come up feeling short.
Wow.
What we need tech companies to do is to be transparent with their data so independent researchers can understand which kids are at risk, What impact are these platforms having? And we need them to design platforms that ultimately support the mental health and well-being of our kids.
That would be fantastic. I have
Yeah.
two 14-year-olds, and you know, I just saw the effect that the pandemic had on them and social media and all that stuff. So that would be really, really great. I want to ask you, it's such an important issue that this country needs, but I feel like sometimes our leaders aren't even leading us in the right path. What do you say we say, or how do we call to action so that we have a success rate with mental health?
Actually, well, so this is why, I believe this is the right time to address this, because I think what's different now compared to 5 years ago was there more people are aware of how important it is to address mental health. They're
That's
seeing
true.
the impacts of the pandemic on their kids, on their families. And so I think there's a new willingness to step forward to say, gosh, we got to do something differently. I'm even seeing changes within government. Just within the last year, the Biden administration, working together with Congress, has actually invested money in getting more kids coverage, healthcare coverage, which is important to get help ultimately with mental health. It's invested in actually beefing up and strengthening mental health service programs,
Great.
in investing in community programs that help address stigma. This is all good, but we've got to put our foot on the accelerator,
Yes.
because our children are hurting. And I believe firmly that, and I see this not just as a doctor, but as a dad, that we have a moral responsibility to take care of our kids when
Yes.
they're struggling.
They're the future.
They are the future, and
Yeah.
every child should know that if they're struggling, they can get help. They shouldn't be ashamed to ask for
Right.
help. So we got to change that, and that's not just about
Absolutely.
policy change; it's about culture change.
That's
and
right.
that starts with all of us.
Right,
Thank
and
you so
feeling
much.
a community.
Thank
You're
you.
amazing. This was so great that we got
Yeah.
you to come here and talk about this. It's
Yes.
so needed. Thank you so much, Dr. Murthy, for stopping by and hanging out with us.